Hi guys, welcome to this topic. I go by the name Dr. Achievement. Today I'm taking on the topic elbow joints. As you can see in the picture below, you can see elbow joints. Alright, we have the anterior view and we have the posterior view of the elbow joints. And in this topic, I'll be covering introduction of elbow joints. I'll be talking about the joint articulation and the ligaments. I'll be talking about the muscles and the nerve supply of elbow joints. Alright. Elbow joint introduction. The elbow joint is a joint connecting the upper arm to the forearm. It is classed as a hinge type synovial joint. In this article, we shall look at the anatomy of the elbow joint, we shall look at the articulating surface, movement stability, and we shall look at the clinical features of elbow joints. Alright. Joint articulation, it consists of two separate articulations, the trochlear notch of the ulna and the trochlear of the humerus, head of the humerus and the capitulum of the humerus. In this picture, you can appreciate the trochlear notch and we can appreciate the capitulum. Alright. Elbow joints, the joint capsule and the bursae, like all synovial joints, the elbow joint has a capsule enclosing the joint. This in itself, it's strong. Alright, a bursa is a membranous sac filled with synovial fluid. It acts as a cushion to reduce friction between the moving part of the joint, limiting degenerative changes. Alright. So there are many bursa in the elbow, but only a few have clinical importance, and those few include the intratendinous located within the tendon of the tricep brachii, the supratendinous between the olecranon and the tendon of the triceps brachii, reducing friction between the two structures during extension and flexion of the arm. Subcutaneous bursa between the olecranon and the overlying connective tissue. Alright. So the elbow ligament, the joint capsule of the elbow is strengthened by ligaments medially and laterally. So the radial collateral ligament is formed on the lateral side of the joint, extending from the lateral epicondyle and blending with the annular ligament of the radius. Alright, so we have another ligament called the unaccurate ligament, originates from the medial epicondyle attached to the coronoid process and the olecranon of the ulna. Okay, you can appreciate this picture, guys. You can appreciate, I've gotten this picture. You can appreciate the green side for the joint capsules. You can appreciate the blue side for the annular ligament. You can see the annular ligament is the blue side. All right. You can appreciate the red side for the ulnar collateral ligament, whereas you can appreciate the yellow side for the radial collateral ligament. All right. Muscles. The orientation of the bones forming the elbow joint produce a hinge type synovial joint, which allows for extension and flexion of the forearm. So extension, triceps brachii and equinox, flexion, brachialis, biceps brachii and brachioradialis. Note, pronation and supination do not occur at elbow joints. They produce at a nearby joint called the radio-ulnar joint. You can appreciate here, this is the triceps muscle at the posterior part of the arm, the biceps muscle, this is the humerus bone, this is the common extensor tendon from the inferior, alright, in the inferior part. Alright, you can appreciate the extensor muscles, but the major common muscles from the elbow joint are these, from here and from here. Alright, these are the major common muscles which function and act in the elbow joint. All right. Elbow joint nerve supply. The arterial supply to the elbow joint is from the cubatal anastomosis, which include recurrent and collateral branches from the brachial and the deep brachial arteries. Its nerve supply is provided by median, musculocutaneous, and radial nerves anteriorly. The ulnar nerve posteriorly. All right. You can appreciate here. You can appreciate the radial nerve. You can appreciate the ulnar nerve. You can appreciate the median nerve. All right. Thank you guys for watching this video. If you're looking for a professional textbook for anatomy, physiology, biochemistry, you can click the link in the description and you will see a very good textbook and you can buy in a very good discount price. Click the link you're seeing in your screen right now and it will take you to my other videos. I've covered topics like shoulder joint, I've covered hip joint and etc. And you can watch these videos and like, share, subscribe if you're coming for the first time. Have a very nice day, guys. See ya.